Hi guys, I'm Rhina Junnette Layug. In a few minutes later, I'll be discussing about measles. But first of all, let's take a look on the measles situation in the Philippines. The Department of Health declared measles outbreaks in 5 regions in the Philippines: Metro Manila, Central Luzon, Calabar Zone, Western Visayas, and Central Visayas. Measles makes a comeback. 15 years ago, the Philippines had nearly eliminated measles, but the virus has made a strong comeback. Since January, the Philippines has had one of the worst measles outbreaks in the world. Measles isn't just a little rash. Measles can be dangerous, especially for babies and young children. Throughout the discussion, the learner will be able to describe the important agent, host, and environmental factors of the measles, able to identify the signs and symptoms of measles, list the complication of measles, and able to describe the preventive and control measures of measles. So let's go back to the history of measles. The word rubiola means red spots. The earliest description of measles was given by the noted Arab physician Abu Bakr, known to the West as Rhazes. Panum did a clinical study of the epidemiology of measles in 1846. In 1946, measles virus was isolated by the Enders and his colleagues in USA. In 1958, measles vaccine was first used in a clinical trial. In 1963, live measles vaccines was licensed for use. What is measles? Measles is a childhood infection caused by a virus. Measles, also called as rubiola, measles can be a serious and even fatal for small children. The measles virus lives in the mucus of your nose and throat. It spreads through the air and by coming into direct contact with someone who has it. Remember, the virus can stay active on the surface and in the air for up to 2 hours. Measles is an acute, highly contagious viral disease caused by the measles virus. Measles is a viral infection of the respiratory system, and measles has been around for more than 1,000 years. Millions of people worldwide get measles each year, and thousands die from the disease. It remains as the cause of death among young children globally. Now I'll be discussing the epidemiological determinants of measles. First is disease agent. Measles is caused by the measles virus or MV. Measles virus is a spherical single-stranded RNA virus with diameters of 100 to 250 nanometer. Second is disease agent characteristics. Measles virus is a member of genus Morbillivirus of the family of Paramyxoviridae. Agent factor. The virus cannot survive outside the human body for any length of time. Measles is a human disease. There is no known animal reservoir. Measles spread through the respiratory contact with the fluid from infected person's nose and mouth and is high contagious. What is the contagious period of measles? People with measles can spread the disease from 4 days before the rash starts until the 4 days after that. Host factor. First is age. Affects usually children in infancy and childhood between 6 months and 3 years of age. Next is sex. Equal incidence in both male and female. Next is nutrition. Measles tend to be very severe in malnourished children, carrying a mortality up to 400 times higher than in well-nourished children having measles. Immunity. No age is immune if there is no previous immunity or previous vaccination. One attack of measles generally confers lifelong immunity. Infants are generally protected by the maternal antibodies up to 6 months of age, and some Immunity may persist beyond 9 months. Now we're going to tackle about the signs and symptoms of measles. What is the incubation period for measles? The typical time from exposure to a person infected with the measles to development of the initial symptoms is 10 to 12 days. The rash occurs a few days after initial symptoms, ranges from 7 to 18 days from exposure. Clinical feature. There are 3 stages in natural history of measles. First is the prodromal or the pre-eruptive stage. Second is eruptive stage. And third is the post-measles stage. First is the prodromal or pre-eruptive stage. It begins 10 days after the infection and lasts until day 14. Characterized by high fever, cough, running nose, loss of appetite, and sore red eyes. And 2 to 3 days after the symptoms begins, appearance of small white spots, also known as Koplik spots. This is a tiny white spot, may appear inside the mouth in 2 to 3 days after the symptoms begin. In 3 to 5 days after the symptoms begin, appearance of measles rash. It usually begins as flat red spots that appear on the face, at the hairline, and spread downward to the neck, trunk, arms, legs, and feet. Second stage is eruptive stage. This stage is characterized by typical dusky red macular or maculopapular rash, which begins behind the ears and spreads rapidly in a few hours over the face and neck. Extends down the body, taking 2 to 3 days to progress to the lower extremities. Third stage is the post-measles stage. This stage is the loss of weight and will remain weak for a number of days. Failure to recover and a gradual deterioration into the chronic illness due to the increases susceptibility to the other bacterial and viral infection, including nutritional and metabolic effect and tissues destructive effect of the virus. The common complications of measles. First is diarrhea and vomiting, which can lead to dehydration. Second is the middle ear infection, which can cause earache. Third is eye infection. Fourth is the inflammation of the voice box that can lead to laryngitis. Fifth is the infection of the airways and lungs, such as pneumonia, bronchitis, and croup. Lastly, fits, caused by a fever and lead to febrile seizure. The causes of measles. Measles is caused by the infection with the rubella virus. As I mentioned before, the disease is contagious for 4 days before the rash appears, and it continues to be contagious for about 4 to 5 days after. Infection spread through physical contact with the infected person, being near infected people if they cough or sneeze, touching a surface that has infected droplets of mucus, and then putting fingers into the mouth or rubbing the nose or eyes. Always remember that the virus remains active on an object for 2 hours. How does a measles infection develop? As soon as the virus enters the body, it multiplies in the back of the throat, lungs, and the lymphatic system. It later infects and replicates in the urinary tract, eyes, blood vessels, and the central nervous system. Now, I'm going to talk about the treatment of measles. Measles give people a fever. There is no specific treatment if there is no complication. The doctor will recommend rest and plenty of fluid to prevent dehydration. Symptoms usually go away within 7 to 10 days. The following measures may help. If the child's temperature is high, they should be kept cool but not too cold. Tylenol or ibuprofen can help control fever, aches, and pains. Children under 16 years should not take aspirin. People should avoid smoking near the child. If there is crustiness around the eyes, gently clean with a warm, damp cloth. Humidifier or placing a bowl of water in the room may help. If the child is over 12 months, a glass of warm water with a teaspoon of lemon juice and 2 teaspoons of honey may help. A fever can lead to dehydration, so the child should drink plenty of fluids. A child who is in contagious stage should stay away from the school and avoid close contact with others. Those with vitamin A deficiency and children under 2 years who have measles may benefit from vitamin A supplement. Now, let's proceed to vaccination or immunization. Recently, there are issues about vaccination, and one of the most common questions is how vaccine works. A vaccine is a substance introduced into the body to stimulate the production of chemicals that destroy specific viruses or bacteria. Measles can be prevented with the MMR vaccine. The vaccine protects against 3 diseases: measles, mumps, and rubella. CDC, also known as the Centers for Disease Control and Prevention, recommends children get 2 doses of MMR vaccine, starting with the first dose at 12 through 15 months of age, second dose at 4 through 6 years of age. The teens and adults should also be up to date on their MMR vaccination. The MMR vaccination is very safe and effective. 2 doses of MMR vaccine are about 97% effective at preventing the measles. 1 dose is about 93% effective. Now, let's differentiate measles with rubella. Measles is caused by a virus which specifically infects the respiratory system. It is more severe and can be life-threatening. Measles is the result in a red or reddish-brown rash. On the other hand, German measles is caused by a virus which invades the lymph nodes, skin, and the eyes. It is milder disease, but pregnant women should be cautious. German measles include red spots with a white center known as Koplik spots in oral cavity. Before we proceed, I will give you a situation. What if an unvaccinated child is exposed to a contagious disease? So this may result to the child's body may not be strong enough to fight the disease. And this will lead us why vaccination or vaccines are important for children. Vaccines are important tools that prevent spread of infectious diseases. Vaccines activate the body's natural defenses. Vaccines protect against serious infectious diseases and save lives. Therefore, immunization is a simple and effective way to protect your child from serious diseases. It is always better to prevent a disease than to treat it after it occurs.